The impacts of cochlear implants on children diagnosed with auditory neuropathy spectrum disorder. In the following slides, I may refer to cochlear implants as CIs and auditory neuropathy spectrum disorder as ANSD or auditory neuropathy. In the first study, cochlear implantation in children with auditory neuropathy, outcomes and rationales. The researchers found that children who were diagnosed with auditory neuropathy are candidates for cochlear implantation. As we've learned, cochlear implantation candidacy is very important. And as we know, some children with sensory neural hearing loss fit this criteria. In this study, the researchers compared those two population groups and found that children with ANSD still fit that same candidacy process. But these researchers had difficulty learning about this disorder, and they feel that more needs to be researched about outcomes and management of this very complex disorder. In the following study, researchers found that hearing screenings, while they can detect some hearing loss, may not be enough. As we've learned in class, an infant can pass a newborn hearing screening, but may have auditory neuropathy. It's important to remember that complex audiometric testing is needed to confirm an ANSD diagnosis. These researchers wanted to find the true etiology of this disorder. When they looked at genetics, prematurity, and conditions, they could not find a common feature that was found with all the children who were diagnosed with auditory neuropathy. In this study, cochlear implantation and auditory neuropathy, researchers looked to see just how well children who had an ANSD diagnosis were able to use their CI after implantation. And unfortunately here, they found that when recommending cochlear implants, it's important to learn why the electrical signal is not functioning. As there are many etiologies for this disorder and research is still growing, it's hard for each patient to be given the correct treatment because of the various etiologies and reasons for an auditory neuropathy diagnosis. It's important to remember that not all patients and participants may make significant gains and progress after a cochlear implant. They found in this study that some participants did very well with hearing aids and FM systems. In this study, outcomes of cochlear implantation in children with auditory neuropathy, the researchers looked at children who were diagnosed with ANSD and other etiologies that led to hearing loss. And all of these children had a CI implantation. They found that the outcomes for these children's language acquisition was great. They found that these children were able to acquire language and speech with this type of treatment. But more research is needed to understand auditory neuropathy and the exact damage that results in the inaccurate electrical signals. Because it's important to remember that whatever the etiology is, a cochlear implant can be helpful if the cochlea is involved. In the last article, Transient Infantile Auditory Neuropathy and its Clinical Implications, infants who are diagnosed with auditory neuropathy are candidates for both a cochlear implant or a hearing aid. But it's important to remember that recommendations should be made on a case-by-case basis and particular to each individual. And the future researches should be conducted to find out what the exact etiology of this disorder is. And a long-term study should be conducted to look at how individuals progress throughout the years and after they're given devices. These are my references.